All right, guys, I want to thank you guys for joining me today on my Poop Tip Tuesday. We have a great show tonight. We're going to talk about colon cancer awareness. Did you know that March is Colon Cancer Awareness Month? We're going to talk about marijuana and the gut. If you subscribe to my newsletter, you know I spoke about this in this week's newsletter. We'll talk about our diet sodas damaging your gut microbiome, and does poor posture actually affect your gut? And your questions live on today's Poop Tip Tuesday. Guys, let's go ahead and talk about poop. Hey guys, my name is Dr. Samir Islam. My passion is to give you tips and tricks to help out with your gut health. I grew up in a small town called Odessa, Texas. You may have known that from the movie Friday Night Lights or even the TV show. I did my undergrad at the University of Texas at Austin, go Longhorns. And I did my GI fellowship training at the Mayo Clinic. So guys, let's talk about poop. All right, so if you're joining for the first time, my name is Dr. Islam, and yes, I'm an actual poop doctor. I'm your poop guru. If you haven't already, don't forget to subscribe to my page. Every other Tuesday, I go live on the social media channels to answer your questions you guys may have. Do me a huge favor. Do me a solid. Let me know if you're watching this live or on the replay. And also let me know where you're watching this at. And if you haven't already, smash that like button. Apparently, this is what drives the engine of social media. I have no idea, but I've been told this as well. And if you have a question you want me to answer, put it in the comments down below. I'll answer them live during today's video as well. Hope you guys are having a great Tuesday. My allergies are going crazy today. I don't know about you guys, but for me, I've been like stuffy all day and sneezing all day. And so I hope you guys are not having the same type of allergies. And I hope you guys are having a great week. All right, so let us go ahead and begin our video today. So Jay Shree, good, thank you for watching. Oh, from South Africa, that's great. Cindy's good, thank you for watching on today's film as well. Krogus, good seeing you as well. Michelle, it's good seeing you. Christina, thank you for watching. Yvonne, thank you for watching on the live stream as well. And also let me know where you guys are watching this show at on today's live stream as well. All right, so we have a couple of questions today. Now, we're going to discuss what I want to talk about first is colon cancer Awareness Month. And now March is the National Colon Cancer Awareness Month, and you'll see in the next couple of videos, in the next couple of newsletters, I will talk about exactly what colon cancer is, and I'll talk about exactly what your risks are with that. So stay tuned for the next couple of Poop Tip Tuesdays and my newsletters as well. But I want you to talk about today, right now, why do we actually even need to talk about colon cancer awareness? Because frankly, colon cancer, unfortunately, is the most preventable cancer that's out there. By far, it is one of the few cancers that actually has a screening test that we can catch early and remove those precancerous lesions before they become cancer. And my hope is that someday I won't ever have to worry about Colon Cancer Awareness Month because there won't be enough colon cancer diagnoses to even worry about this. But I want to tell you about a story of a patient of mine. He was a 60-year-old individual who came to see me for routine colonoscopy screening. He's been told ever since he was 45 or 50, that he needed to get a colonoscopy done. He ignored it because he heard the horror stories about the prep. He heard other stories that other friends had told of him, and he frankly didn't want to get this done. And he eventually came to see me because his wife told him he needed to get checked out to make sure everything was doing okay. And we talked about the risks and the benefits of the colonoscopy. I talked to him about why I recommended for him to go ahead and proceed with the colonoscopy as well. We did the colonoscopy last week, and unfortunately, he was diagnosed with colon cancer. And I can tell you, this is such an unfortunate story because it happens more often than it doesn't. And I see this all the time in my office where patients or people delay getting their routine colonoscopies because they're worried about the prep. They're worried about the sedation. They're worried about that camera going in, and they want to know exactly if there's going to be a problem with that. And because of these fears, they end up delaying things, and those fears end up leading to the diagnosis of colon cancer. And the unfortunate thing about colon cancer is that it typically doesn't present as anything until it's too late. By the time you have cancer, that's when you have symptoms of bleeding, change in bowel habits, weight loss, abdominal pain. And our goal is to find these precancerous lesions before they become cancer and remove them so you don't have to worry about them
and they don't have to ever cause symptoms for you or your loved ones as well. So what can you do today to prevent your risk for developing colon cancer? Number one, your diet does play a role in developing that risk. We know a pro-inflammatory diet, a diet that's high in meats, processed foods, foods that are high in inflammation, are going to increase your risk of developing colon cancer. We're seeing more and more information of the effect of diet on your gut microbiome and how that can play a role in developing your higher risk of developing cancer, including colon cancer. Number two is that you need to know your family history. Do you have a family member that's been diagnosed with colon cancer or even colon polyps? Yes, that's important as well, because if you have a first-degree relative or multiple second or third-degree relatives, this could mean you have the genes that can make it more likely for you to develop colon cancer. And the third thing that you need to do to prevent colon cancer is to get a colonoscopy. Now, I know there's so many cancer tests that are out there for colon cancer, but universally, every single GI doctor, including me, who specializes in colon cancer and colon tests, recommends getting a colonoscopy. By far, this is the most effective test. This is the most accurate test. It allows us to find those precancerous polyps and remove them as well. It's fantastic. The complication rate is low. The prep is better. You're asleep the whole time. It's the best sleep you ever had. But by far, this is going to be the most important thing that you can do when it comes to colon cancer. So let me know in the comments down below. Do you have a question about colon cancer or colon cancer screening? Do you have a question about the colonoscopy itself? Comment down below. I would love to hear what you guys have to say. But really, please, if you haven't already, please get your colonoscopy to get screened for colon cancer. All right, perfect. We'll go into question number 2, but let me go into a couple of the live streams as well. Jenny, yes, this is live. Thank you for watching. Tina, thank you for watching from Michigan. Angela, thank you for watching from Canada. Judy, thank you for watching from Wakatachi. Thank you. Melba, thank you for watching as well. And let me know once again if you're watching this live or on the replay. And also, if you haven't already, don't forget to smash that like button. Like, share, and subscribe so I can know, and so I know that you're following me and you can get tuned into more videos just like this one. All right. So a question here. Can you please talk about the differences between IBD and IBS? I've been unresponsive to IBS treatments and now being evaluated for IBD. Great question. That one letter makes a huge difference when it comes to what you have. So IBS stands for irritable bowel syndrome, and whereas IBD stands for inflammatory bowel disease, and this includes Crohn's and ulcerative colitis. Now they can present similar ways, but they have vastly different other entities as well. So they can both present as either diarrhea, sometimes abdominal pain as well. But for IBS, irritable bowel syndrome, this is typically a clinical diagnosis. If I talk to you, get your history, do an exam, maybe do some limited testing, this can give us about a 95% predictive value of diagnosing you with IBS. And the most common symptoms can be pain. You have to have pain with IBS, with change in your bowel habits, either diarrhea or constipation, or a combination of the two. And this would allow us to have the diagnosis with IBS. Now, for some individuals, we may do blood testing, we may do scopes, but if we do a colonoscopy, we typically don't see anything on this scope to tell us that you have any inflammation going on. And this is very typical of IBS. And the treatment for IBS is based on your symptoms. If your symptoms are bloating or pain, we will focus on that. If your symptoms are diarrhea, we'll focus on that. If your symptoms are constipation, we'll focus on that. The good thing about IBS is that it does not kill you, nor will it lead to cancer. It sucks, it's not great, but it does not lead to anything bad. Very different from inflammatory bowel disease, including both Crohn's and ulcerative colitis. Now, in order to diagnose these things, you need a combination of different tests. You need blood testing, stool testing, imaging, and sometimes, and in fact, the gold standard will be a scope as well. We can actually see inflammation going on inside your GI tract. We can see ulcers, inflammation, narrowing, stenosis, a lot of scarring. And these combination of tests will allow us to diagnose individuals with Crohn's or ulcerative colitis. Now, in order for us to treat this, we have to put you on pretty strong medications for this. Medications that help to suppress the immune system or suppress the inflammation and keep everything at bay. And the problem with inflammatory bowel disease, or IBD, is it can lead to long-term complications. It can lead to colon cancer if left untreated. It can lead to profuse bleeding, anemia, fatigue, joint issues, other issues outside the GI tract, nutritional issues. It is a serious problem and a serious disease that really does need very effective and serious therapy. And that one little letter makes a huge difference in terms of what those particular symptoms are. If you have a question about IBS or IBD, comment down below as well. I'd love to hear what you guys have to think. Or have you been diagnosed with one or the other? Or did you get a confused diagnosis? You're not quite sure exactly what's going on. Comment down below. I would love to hear what you guys have to say or think about that. All right, next question. Marijuana and the gut. Oh, this is a great question because I get so many patients come to see me who take marijuana and have gut issues, or they take marijuana because of their gut issues. And if you subscribe to my newsletter, which if you haven't, you need to, I talk about this in depth. So we are seeing more and more information out there of how marijuana can affect the gut microbiome and your GI tract. It's fascinating seeing this research out there. There are some studies to suggest that marijuana can help out with inflammatory bowel disease, or IBD, like Crohn's and colitis. We're seeing patients who have symptom response to this, their symptoms get better, and we're seeing some evidence of inflammation going down as well. We also know that marijuana has also helped to treat symptoms associated with other GI conditions, including gastroparesis, abdominal pain, sometimes irritable bowel syndrome as well. What we also know is that marijuana itself causes gut issues. It's so confusing. In fact, one of the more commonly caused gut issues is called cyclical vomiting syndrome, in which you have episodes of nausea, vomiting, and it stops, and then you start to do okay, and these episodes come back again, nausea and vomiting. It is cyclical in nature. And one of the more common triggers is actually marijuana use. But a lot of my patients smoke marijuana because they're having nausea and vomiting. But then that marijuana in turn causes nausea and vomiting. It ends up being a vicious circle going on there. And it's very hard for us to describe to individuals who smoke marijuana that what you're smoking is actually the reason why you're having the gut issues. It's not making things better, because if it did, you would not have the nausea and vomiting. And so we're in the very early stages of how marijuana can affect the GI tract. And I think that in the next couple of years, we're going to start to see better forms of this particular option for treatment. And I think we're going to start seeing the doors open up more on using marijuana as a way to treat some gut issues. So my question today for you guys, have you guys tried using this? Has it worked? Do you feel like it's helped out? Let me know in the comments down below. I'm really curious what your thoughts are on that as well. All right, once again, I'm Dr. Islam, and every other Tuesday I go live on the social media channels, answer your questions you guys may have. If you haven't already, don't forget to smash that like button, like, share, and subscribe. And also let me know if you're watching this live or on the replay as well. I love to hear where my audience is watching my videos from. All right. Let me go through the comments here. Melba, thank you for watching as well. Yvonne asks, what age should I get a colonoscopy if I've never had it? Great question. So the screening guidelines changed in the past year or two to now 45 years old. If you are 45 years old, you need to get a colonoscopy. Now, if you have a family history, especially if it's a first-degree relative, it should probably be sooner than the age of 45. Now, it depends on the age of the relative who got diagnosed. I would highly encourage you to speak to your doctor about whether you need to get your testing done earlier or if you're okay waiting until the age of 45. The other thing I want to mention, though, is that if you're having symptoms, pain, bleeding, change in bowel habits, weight loss, don't wait, because that could be a sign of something going on inside the GI tract. And if you're having symptoms, come see somebody like me where we can fix and find out what is going on. Let me know in the comments down below if you have had somebody who got a colonoscopy done and they actually were able to find precancerous polyps and actually were able to remove those. I love to hear those stories because this allows us to prevent colon cancer from forming in those individuals. All right. Judy, thank you for watching. Jenny, thank you for watching as well. Cindy, a very good question. So Cindy says that she's getting colonoscopies every 5 years, and is this enough to help prevent colon cancer? Well, it's a very good question, Cindy, and I cannot answer this in particular for you because I don't know your history. But the reason to do colonoscopy sooner are if you have a family history of colon cancer, especially if it's a first-degree relative, if you've had colon polyps removed in your prior colonoscopy. And what's important about that is how many polyps were removed, the type of polyps, and the size. If you have a good GI doctor, they're able to determine all that and give you that information. Typically, it does take maybe 5 to 10 years for colon cancer to develop from colon polyps. So in most cases, the 3 to 5 year range is usually enough time for us to find those precancerous polyps. But once again, it really depends on your family history and what they found on the colonoscopy as well. Great question. All right. Adrena, thank you for watching from New York. Christina, thank you for watching. Fran, thank you for watching from New York as well. Jerry Sue, thank you for watching from Pennsylvania. And Sandra, thank you for watching as well. Perfect. All right. Let's go to the next question here. Next question. Hey, Dr. Islam, are diet sodas damaging for your gut microbiome? Let me know in the comments down below. What do you think, or what are your thoughts on that? Do you think that diet sodas are bad for you, or does it damage your gut microbiome? So before we go into that, what exactly is the microbiome? The microbiome is a collection of trillions of bacteria, fungi, yeast that are constantly interacting and talking to each other. And your microbiome basically is made up of good guys and bad guys. And there is a constant battle between these two forces to try and figure out who's going to win. And the winner tends to help control what's going on inside your GI tract. Here's what we know when it comes to diet sodas. We do know there is a change in your gut microbiome if you drink diet sodas. We know that there tends to be more bad guys and less good guys whenever you drink diet sodas. We think this is mainly due to artificial sweeteners. And this is exactly why a lot of my patients have a lot of bloating, because their gut microbiome is out of whack because of the artificial sweeteners that they intake either through diet sodas, or maybe using artificial sweeteners in their coffee and their drinks as well. The important thing about this, and I don't want to miss the forest for the trees, is that these studies are based in lab animals. So I'm not a lab animal. I hope you're not either. So we don't really know what these effects are going to be in humans. We really don't. We have no idea. So we do know that artificial sweeteners in diet sodas may be affecting your gut microbiome, but what the long-term impact is, honestly, we just don't know. And until we know, I really don't feel strongly that we need to make a big push to avoid diet sodas. And now I'll tell you, one of the more important myths that I've seen a lot of people talk about are, does diet sodas lead to weight gain? Let me know in the comments down below, what do you think about that? Have you heard this before? Have you heard of diet sodas leading to weight gain? Well, the answer to this is, maybe a little bit, but not as much as people make you think it is. There's so many things I've seen out there on social media on how people are suggesting that diet sodas can lead to weight gain. And the fact of the matter is, I would much rather you drink a diet soda than a regular soda, because a regular soda for sure will cause you to gain weight. So in the grand scheme of things, if you enjoy diet soda, it's okay. I'd rather you have that than drinking a real soda, which is going to totally jack up your gut microbiome and totally mess up your weight loss journey as well. So what can you do to help improve your gut microbiome naturally? Here are 3 things I recommend. Number 1, you need to be more on a plant-centric type diet. Now, I stress that because I know it's hard for people to really go all plants. I completely understand. But if you're able to add more plants to your diet, make the vast majority of your plate plants, this is going to be the best thing to help make sure you improve your gut microbiome. Number 2, you really need to eliminate processed foods. It is not good for you. That will jack up your gut microbiome more than any type of artificial sweeteners or anything else. And number 3, if you can minimize as much as you can animal fats. We're seeing more and more studies of how animal fats really does affect what's going on inside your GI tract. It produces a lot more inflammation. It can make things worse for your gut as well. All right, perfect. All right, next question. Does poor posture affect your gut? Well, let me know in the comments down below. What do you think? Do you think if you slouch down like this, it's really going to affect your gut? Or do you need to stand up straight? I'm really curious to see what you guys think. Well, the answer to this is yes. Posture does affect your gut. The more that you slouch down like this, the more worsening reflux you're going to have. It makes it easier for your valve to be open longer and more often. It makes it easier for that acid to go up into the esophagus to cause burning and regurgitation. It makes it easier to have a lot of upper GI issues. Number 2 is that it can also make fecal issues or bowel movement issues a lot worse. Whenever you're scrunched down like this increases the abdominal pressure in your bottom, and that in turn put more pressure both on your colon and your bladder, leading to both fecal incontinence or soiling yourself and even urinary incontinence as well. And lastly, we know that posture does play a role when it comes to constipation. In fact, one of the more common causes of constipation are those rectum muscles being closed too tight and not leading to you to have a bowel movement. That's called pelvic floor dysfunction. And if your posture is not right, that can cause those rectum muscles to be constricted and to make things more difficult for you to use the restroom. So what can you do? Well, the obvious thing, number 1, is to sit upright. Oh yeah, this will help out. Whether you're sitting at a desk or sitting on the toilet, sitting upright is going to help. Number 2, if you're using the toilet, use a stool. I am a huge fan of a stool to lift up your legs, put your legs above where the toilet seat is. This helps facilitate the natural angle to allow you to have a better bowel movement. And then lastly, as much as you can, don't squinch over. It's easier said than done, but if you can do this, this is going to help out with your bowel habits as well. Let me know in the comments down below, have you noticed if your posture has made a difference when it comes to your gut issues? I'd love to hear what you guys have to think. All right, let's see if I can answer some more questions. So Jerry Sue asked, what is the best position on the toilet for an easier bowel movement? This is a fantastic question. I love this question because your position of your bowel move, your position of where your legs are, really will affect how easy it is for you to go. So the best thing that you can do is if you can have a stool and have your knees elevated a little bit above where your toilet seat is, that actually helps to facilitate the natural angle to allow you to have a more effective bowel habit. It prevents things from getting caught up in your bottom area. It actually allows things to slide on through to have a really good bowel movement. This is why a squatty potty is so effective. It works and it tends to help out. Let me know in the comments down below, have you noticed if the position of your feet whenever you use the restroom plays a role in terms of you having a better bowel movement? Great question. Kobe, thank you for watching from the Philippines. I appreciate that. So Ronnie Ron asks, how many hours to eat before going to bed? This is a great question. In fact, this is one of the most effective ways to help control gut issues at night. Because if you go to bed too quickly before you eat, that food just sits in your stomach and it goes up and causes gut issues. So typically it's 3 hours after you eat that you should lie down. That gives enough time for you to digest the food and for food to leave your stomach and to go into the small intestine and not cause any issues. So it's about 3 hours is my recommendation to allow you to have more effective gut issues and to prevent things from getting worse. All right. Sorry, I'm just going through some questions here. So Giselle asked right here, how long does IBD take before it can turn into cancer? So it's a very good question. It can depend on how much inflammation is there. It can also depend on whether you have Crohn's or ulcerative colitis as well. What we do know is that if you had ulcerative colitis, if you've been diagnosed for at least 8 to 10 years, that substantially increases your risk of developing colon cancer. And same thing with Crohn's colitis as well. So if you've had it for 8 to 10 years, after that, typically you need to get colonoscopies every 1 to 2 years just to make sure we can keep an eye on that colon and prevent that from progressing into colon cancer. All right, guys. Well, if you haven't already, don't forget to smash that like button, like, share, and subscribe. Also, let me know in the comments if you have any questions as well. And also let me know if you're watching this live or on the replay as well. So Fran Johnson asks, is fasting better for your gut? Well, Fran, that's a great question. I am a big fan of fasting. I do it all the time. In fact, I've done intermittent fasting for quite some time. I'm not doing it right now, but I've done it for a long time. And for the right individual, I do recommend it because it really does help out your gut. Your gut is constantly working and on the move, and it's constantly trying to move things through and digest things. And by giving your gut a rest by fasting, it allows your gut to almost reset itself and to not have to go through all that work of trying to get food down. And for a lot of my patients have gut issues and also have weight issues as well. By skipping one particular meal, you can actually minimize the amount of weight that you're intaking. And we're seeing some evidence of how this can also change on a microscopic level what is going on inside your body as well. So I'm a big fan of fasting. I've done it for a long time. I typically do a 16-hour fast if I do decide to do it, and it works great. I've had a lot of patients who have success with that as well. Great question. All right. All right, guys. I think that's most of the questions I have seen. Perfect. I want to thank you for watching. If you haven't already, don't forget to smash that like button. Like, share, and subscribe. And if you haven't already, don't forget to subscribe to my newsletter, my social media. If you haven't already, don't forget to subscribe to my weekly newsletter. We can get great tips and tricks like you're learning in today's video. Also, don't forget to subscribe to my social media channels when you get notifications of when I'm coming on next. But I hope you guys have a happy and healthy Tuesday. And guys, don't forget, let's talk about poop. Thanks, everybody.